Welcome to this Regimen. This is Public Health Global Grant Program. Through this program, we are podcasting the success stories of public health in Sri Lanka. Through that, we can enhance the knowledge, attitude and practices of currently working public health staffs and other related peoples. So, the Department of Community and Family Medicine, University of Jaffna, got this grant for 26 years. So through that, we are interviewing the pillars and the experts who supported these success stories. Sri Lanka is celebrating the 100th year of public health this year, 2026. So this very important milestone we are staying. So we are going to interview the experts and the pillars who had made these success stories in public health. So I am Dr. Coonghe, Senior Lecturer in Community Medicine from the Department of Community and Family Medicine, University of Jaffna. Today we are having the person to do this podcasting, a very known person in the country and worldwide, especially for soil transmitted infections. Professor Nilanthi Silva, Chair Professor of Parasitology, Department of Parasitology, University of Kelaniya. Welcome, Madam.
Thank you for inviting me.
Okay, Madam. You have huge stories of this expert experience in this public health and this communicable disease control. So, if Sri Lanka historically had a high prevalence of soil transmitted infections, especially hookworms and roundworms and whipworms, right? So this prevalence was early, it was 93%, almost all population was affected by that. So my question, Madam, for your experience, could you describe the key factors that led to this reduction in Helminth infections or infestations nationally? Currently we are experiencing only less than 1% population is affected by this infestation, so huge reductions. And what methods were used to achieve this elimination, Madam? So,
okay, first of all, I think I should mention that gap that you talked about, that we started off with over 90% prevalence rates, and that now we are currently nationally at maybe 1% or less, has happened over nearly a century, right? Because those island-wide national 90% rates were from the surveys that were conducted in 24-25, that kind of period. And now we are 24-25. Now we are in 2025.
26.
Right? So it's really over a very long period that we have seen this decline. But having said that, I should say that the activities to control these levels of infection started even at that time. The main strategy was the use of deworming, right? So treatment, right? And treatment as in regular deworming. So it is not really ideally a preventive measure, but a treatment measure. Okay, so in that sense, I don't see it as true public health, because for me, actual public health is prevention rather than trying to cure. Okay. Right? But nevertheless, that is what was done with mass deworming programs. And unfortunately, when in those days, in the sort of the 1920s, 30s, even coming up to the 1960s, really, the antihelminthics were not very effective, right? They were using things called chenopodium and various other antihelminthics which are completely not in use anymore, but they were not really effective. So it didn't do much good. It's only later on with the introduction of the broad spectrum antihelminthics. So it started with maybe piperazine, and then after that mebendazole first, and then albendazole. And I remember when I was a medical student in the 80s, mebendazole had to be purchased on local purchase. It was not available in the hospitals, right? So that is in the 80s, it was still something that was seen as an expensive form of treatment. But nevertheless, there very effective against roundworm, hookworm, whipworm infections, and those are the things that then really brought the rates down. So that's one side, the chemotherapy, preventive chemotherapy as the WHO calls it, right? And use on a regular basis, really, I think I should explain something else which is very specific to Helminth infections, and in particular these soil transmitted Helminth infections, that it's not a question of simply being infected but also the worm burden. How many worms a child or an infected person has, and the more worms that you have, the more likely you are to be ill and suffer consequences from the infection. The intensity of the infection. So whether it is hookworm, the risk of being anemic just goes straight up depending on how many worms you have in your gut. The problems related to ascariasis, intestinal obstruction, migration, ectopic migration, and so on, again it's related to the intensity of the worm burden. So what chemotherapy does on a regular basis is that if a person is at risk of infection, they reduce the worm burden. It reduces the worm burden. So then the risk of being ill because of the infection is much less. So in that sense, it's a very useful, effective form of controlling the infection from a public health perspective, right? So that's the preventive chemotherapy side of things. Then the other really important thing in disrupting transmission is sanitation, right? Not even so much as water, but actual safe disposal of human feces, use of ideally water-sealed latrines, right?
Exactly.
So that the fecal matter from, so these infections are actually quite specific to host-parasite relationships, are very specific. They can't develop to full maturity in any old animal, right? So it's human feces contaminating the environment that leads to infection in other people. So safe disposal of human feces will pretty much make sure that you have got rid of the infection. The problem with safe disposal of human feces, you need latrines, and that's expensive, right? Exactly. So it is with the improvement in living standards that really started having impact on transmission in Sri Lanka. And then the third thing, this is also important from a public health perspective, is a awareness of the public regarding the infections, how they get the infection, and about the value of deworming. That public acceptance of that those facts and internalizing it, and then acting on it on a regular basis, those three, I think, in our country, that's what has done the trick for us.
The deworming, definitely, I think, as you mentioned correctly in the things, especially this public awareness, making public awareness and regular treatment for this deworming. I think the education sector did a marvelous job on that, I think. So free education is a huge impact on that.
And free education, especially education of women.
Women
because
education.
Because these are infections that affect children, preschool and school-going children. And if the, I did my very first piece of research into soil transmitted Helminth infections, I did in Kandy, in a low-income settlement in Kandy in Mahayava. And I looked at preschool children and the prevalence rates in those children and correlated it with their mother's education status. If just the simple fact of a mother not having gone to school at all versus gone to primary school gave us a significant odds ratio.
Definitely.
Right? So a little bit of education of the mother makes a difference as to whether the child is dewormed or not, whether the child is going to be worm free or not. So
definitely, madam, I think free education, especially the female education, we enjoyed. The public health success is not only with the health departments, especially we have to thank for the education sector, especially not only with the Helminth infections, maternal and child health, all the indicators are interrelated with women education. So let's think. So, and also the sanitations, I think economic improvement, that I think another aspect, I think the housing schemes and the people.
Again, in relation to sanitation, that economic improvement, that awareness is essential, because what I've seen is that you can have, if that community is not used to using latrines and people go in there and they invest in building latrines, if they're not convinced that this is what they should be doing, they don't use them. I've seen instances where I've been working in the estate sector where the latrine was being used to store firewood, because keeping the firewood dry was seen as more important than using that latrine for disposal of feces. Right? So, in the minds of the people, that it was not the priority.
That's again the education.
Yeah, exactly. So, that is, if they go hand in hand.
You should have. Okay, Milanthi.